Hi, and welcome to Truth, Health, and Wellness with Matt and Deborah St. John. We are so glad you're here with us today, and Matt and Deborah have got lots of great things to talk about with you, information I want to say. So tell us about this past week, and especially with the holidays, with Thanksgiving, what all have you guys seen and been answering?
Right.
Well, it's been a very busy week at St. John's this week, actually, post-Thanksgiving. I think a lot of people were getting together, more so than normal. So we've been seeing a lot of basically throat, ear, and respiratory and stomach infection. A lot of ear infections have been coming in, especially today.
Right. Yeah, a lot of viruses, and then of course, other than the common overeating and dietary issues of people eating, the Aunt Susie, accidentally getting Aunt Susie's, green bean casserole and not realizing, that they did it until afterwards. We have gastro issues, obviously, always when we have the holidays. People overeat, they eat too much sugar. They'll eat a lot of foods that will contain margarine, and maybe they cook at home with butter, and because they'll eat some margarine, just a small amount can make a big issue with their gastrointestinal, tract. And so I always tell people after Thanksgiving, go for a walk. Make sure that you're diligent in your health and as good as you can be when it comes to what you're eating and putting in your body. We like fruitcake, for example, but you can't find fruitcake without high fructose corn syrup and artificial colors, and so you have to be a little careful. And if you do have fruitcake that you don't want, send it over to St. John's Nutrition. If it doesn't have high fructose corn syrup, we'd be happy to eat it for you.
And hey, really quick for everybody out there, if you do have questions, please go ahead and call in or send them in live on Facebook, and we're going to try to get them answered for you right now. So any questions you've got or anything you want to see if we've got a possible answer to help you with something, they're here for that. So call or email a question in on Facebook. So back to what you said, Deborah, with like the ear infections, and especially because of the weather changing out there. What is it looking like for what you might help people with when they come in right now with that?
P77 is a big one. You can use P77, which is our formula that has the carvacrol, it has artemisia, it has beta-pinene in a base of hemp oil, and it does really well for almost any infection, viral thing. You can use it in the ear. You can actually put a drop in your ear, and it'll help clear up an ear infection pretty quick. And then, the strep throat, the COVID, even the viruses in your gut, it'll clear it all up. I know it's not exciting to take things when your stomach hurts, but if you'll actually use it, it really helps.
Yeah, I remember sitting on a bed in Iquitos, Peru, not wanting to take P77, but I was very happy that I had it. Nothing like a little Guardia on the trip home. To make your need of P77 far greater. And we had given away almost everything that we had, so that was also a little spooky. We only had a little bit left, but P77 was a formulation that we did during COVID, and we actually sort of borrowed on research that was being done in Madagascar when they were using the Artemisia plant, and they were using it rather than taking vaccines. Their vaccine rate was 1.2%, yet they've eradicated COVID, and they had lower COVID rates than anywhere, Israel and Dubai and all these other places that had 100% COVID vaccination rates. So we developed this formula. We say the Lord gave it to us because He did. And it's been amazing. We actually advertise if your kid is sick, or if you'll just take this P77 and your kid gets sick, we just give your money back. And we advertised that, and we did that during COVID. And of course, we never had to give anyone their money back. During COVID, we stopped counting at 550,000 people that used P77 that never contracted COVID-19 during the entire 3-year period. Wow. And that's one of the things that's most exciting to us about that formula. And then now we have Peruvians using it to help with their malaria, their dengue, their issues that they're having. And then also, if you haven't heard, In China right now, they're having rampant pneumonia. That's drug resistant. Well, it's drug resistant, but it's not carvacrol resistant, it's not artemisia resistant, and it's not beta-pinene resistant. And we actually put up something on St. John's the other day that, actually the other day, it was today. It's been a long day. We put up something that actually shows clinical studies. There are clinical studies showing the efficacy for every ingredient of P77 against drug-resistant pneumonia.
Oh,
and
wow.
so there it was. It's like, well, it may be drug resistant, but it's not P77 resistant. And then I said, of course, no matter what the world throws at you, even things that are designed to make you sick. In the case of pneumonia, that's because so many people are developing and contracting pneumonia because of the overuse of antibacterial soaps and things and sprays in hospitals. And so most people know if you want to go to die, you basically go to the hospital.
Right.
You can either get sepsis or you can get pneumonia, either one, but you'll die either way. Chances are if you're there long enough. And we won't even point any fingers at that one or mention anything about local hospitals, but at the same time, it's true. So people that take P77, they're literally, we have nurses sneaking P77 into the hospitals to give to patients who have pneumonia so that their hospital, doesn't have such a record with pneumonia.
We actually had a lady come in today talking to me about after Thanksgiving, she had been with her whole family. She was taking P77. Everyone in her whole family got sick except for her.
Oh, wow.
She was so thankful to have it. She came in and bought several more bottles to take to her family.
And we're a nonprofit, but at the same time, people purchase things from us so that we can do what we do. And we tell people, if you get sick while taking P77, you're just going to give your money back.
Yeah.
I mean, they had us, we're part of the Concerned Doctors Group, which was very, very popular during COVID, and they actually, had us, on several occasions speak on behalf of P77 and talk about the formulation. It was, once again, it's amazing, and so we use it a lot. This time of year, it's just a necessity for most people.
Absolutely.
It sounds like it is. Well, hey, we've got a couple of questions here, so let's see if you could talk about one of our viewers, Billy, a rare blood disorder. It's called ITP. Is there anything that you know that could be done besides taking steroids or chemo treatments for that?
Boswellia has had some studies that's shown efficacy against the ITP, along with a lot of your cardioprotectives. We actually have just finished development of something called Cardio 24/7, St. John's Cardio 24/7, and it uses beetroot, which is really good to increase nitric oxide. Now, it's not nitrous oxide that makes your car go faster, it's nitric oxide, which is a gas. Believe it or not, it's a good gas. It's the kind of gas that makes people happy. And so people that have nitric oxide elevation will have normally a decrease in blood pressure or normalization of blood pressure, and they'll also have cases where they'll have more cell volume, water volume to their muscle cells, and they have faster recovery. The bodybuilders and sports nutrition folks were using it originally, but then it was discovered that it's a vasodilator. And anything that's a vasodilator that does it consistently will open up the arteries, and it'll open up the veins, and it'll help with the free flow of blood. And that helps with arterial plaque. So it's kind of like a Roto-Rooter for the veins and the arteries. And so this is something that helps a lot as well. A lot of people say, well, we need to be on statin, you need to do all these different things. And when it comes to statins, there are so many problems and side effects that even the best cardiologists in the world have stopped almost prescribing statins. There's a push for almost everyone in the world from young to old to take statins, but we see the problems with statins on a regular basis. Same thing typically happens. I'll get a message from someone on Facebook, and they'll say, I'm having issues with my legs, I'm having issues with my pain, and I'm just exhausted all the time. I have no strength in my muscles. And the first thing I ask is, are you on a statin? Of course, normally they say yes. And I'll say, how long have you been on the statin? And then normally it's OMG ... 2 months. Which is how long they've been dealing with the leg pain or the fatigue or the weakness. And so I'm thinking, well, there you go. You just answer, and then I'll send them a link to some some literature and some article that will support the fact that these things are killing people in many cases. So the best, even Dr. Edmond, we had a conversation today about statins and how he's not as fast to prescribe them as people even want him to be, because they'll see the commercials. Hey, Crestor, they advertise it on TV.
Right.
I must need it. So they'll come asking for it. Hey, I need some Crestor, right? Well, no, your total cholesterol is 180. Oh, I want it anyway.
Yeah.
No thanks. So there's a lot that people can do for their blood and general blood disorders. What we recommend most is for people to come in or call at St. John's, and they can schedule an appointment. We can talk to them, in depth.
And what you were actually talking about with it, is it a pill or is it liquid as well, like your?
The Cardio 24/7 is a powder.
Okay.
And it's really neat because we use tamarind, and we talked about tamarind.
Yes.
I think we spoke about it on the last show. Tamarind not only helps with the pineal gland and to help with cerebral spinal fluid inflammation and that sort of thing, but tamarind is amazing as a cardioprotectant. And then we add hawthorn, which has a plethora of research as far as heart rhythm and regulating heart rhythm, and then there are the cofactors of the citrulline and the beetroot juice. Now, I've been drinking beetroot juice every morning for, I don't know, 5 years or something,
Yeah,
maybe 4 or 5
at
years,
least.
and I can't stand the stuff. I mean, beets taste like dirt. It's like bloody dirt. Now, that's just not very
I agree, I
appetizing.
can't- yeah.
But, I mean, when you know what it does,
Right.
when you know what it does, the second that you drink beetroot juice or chew beets that now the pickled beets are different, they put tons of sodium in them, so that kind of is counterproductive. But when you're chewing beets or you drink the beetroot juice, you can actually feel within normally about 5 or 10 minutes a decrease in blood pressure. And so it helps a lot of people and because of the nitric oxide elevation.
Okay.
So it's the beetroot powder is really good if you can combine it and make it in a formula that doesn't taste terrible, which is finally what we pulled off after about 3 years of development. So we're excited about
Taking
it.
some time.
It's going to be about a week.
Yeah.
Got to get the containers
Next
and
week.
the rest, in the larger size containers.
Because I tried, someone brought me a beetroot freshly juiced juice in California to work one day, and nicely I drank it, and
Yeah.
I'm like, yeah, it's just so lovely.
Well, there-
it was not good.
Yeah, there are
but I
people
knew
who
the
like
health
it.
benefit, like you said.
Yeah.
So-
At least you felt good that day
Yeah.
afterwards, after the taste went away.
Exactly. Well, hey, a shout out to Jennifer Norman. You know who that is,
Hey,
right? on?
Jennifer, the Norman
Jennifer.
family. Oh, let me
Hey,
tell you a story.
Jennifer.
Let me
Yeah,
tell you
go
a story.
for it.
So we get to what was it, the first trip? The second trip?
Second trip.
Second trip, we were going to the Amazon. We'd stayed at a place that was called, it was an Amazon Oasis Floating Lodge. Wow, I nailed it. And so this wonderful Christian family that owns this place. I mean, literally, it's prayer in the morning. It's praise and worship music. They'll even be sitting there jamming on the keyboard. They have revival, and then at night they're praying. And we actually heard a couple of people get offended one time, and they left the next day. I'm thinking, yes, I love people who are someone to hate. By people who hate others who are nice. But anyway, so we love this place. Well, when we get there the first time we went to the Amazon, I was like, I might swim in the Amazon. It was like this big deal, and we're like, no, maybe not. And then finally, by the time it was over, it's like, we didn't swim in the Amazon. Both of us were like, well, I really didn't want to. Second time we get there, and I'm like, I'm going to swim in the Amazon. But she's apprehensive about it. We get there, and there's these two little gringo kids swimming in the Amazon with some of the kids from the floating Oasis Lodge. And I'm like, okay, their children are floating in the Amazon,
Right.
these kids. And there was this Canadian family, and once again, you don't see many gringos anywhere near Iquitos, much less a family who's got their kids floating in the water with the kid. They didn't speak a lick of Spanish, but yet they were all playing together. It was wonderful. And it's this wonderful family. And I'm not just saying that because you put the thing on, they know how much we love them. So we met them, we interacted with them, and they were there for us after the first time I used Cambo. I had a Cambo session. We actually, at the floating lodge, they ran over to my friend who was going to administer the Cambo, and they're like, no, we have insurance. And I'm like, hey, insurance liability carries over. So they're like, we don't want you to die of some frog poison. So they took us out in a boat in the middle of the Napo, the Napo River, which happens to be where most of the malaria is in anywhere near Iquitos. We didn't realize that. We were getting mosquito bit and everything else. So I didn't get malaria because I had Cambo. Unfortunately, my wife didn't have Cambo and ended up with malaria, which we cured naturally with Artemisia weeks and weeks later. But anyway, so actually they were hanging around while she got malaria and I did Cambo, and we came back and it was such a neat interaction. We got so close to this family, and they're an awesome family. They travel, and I could tell stories about, I don't know how much personal stuff they want us to share, but they're one of those families who just gets it.
Yeah.
And they gave up on material things, and they understood that rather than just making a good living and having big houses and all that stuff, that traveling and having their children experience other cultures was more important. And so they took out a year, I think it was.
And doing good. I mean, they
were given to
making sure to make a difference wherever they
Right.
went. And that was really awesome.
Yeah, and now they can't even travel. Kind of like us, it's like the idea of traveling. Even we go to Destin, was like, well, let's go do something for someone else, because why bother? Why bother traveling if you're not going to bless someone else? And so they're those kind of people, and so we love them.
Oh,
Go Normans.
awesome. And Canadians, right? So
Go Canadians, yeah. Well, actually, what's interesting is I've never met Canadians that I really felt a closeness to until we met them. So they were good representatives from Canada, let's say that.
Well, I'm going to jump to some questions that, again, first off, those of you watching, if you do have questions, please send them in live by Facebook or call, and we'll be glad to see if we can get some answers for you. That's what this is about. We want to help as many people as possible. So another question someone had, can clothes or towels used by someone else spread infection if you use them, especially if it's an athletic family with, your son's an athlete, your daughter's an athlete, and they're swapping clothes here and there, or towels?
Yeah, first of all, old towels and used towels and washcloths, have to be concerned about mold, and that has nothing to do with the human contact, but it does have something to do with wet towels that have been sitting around. Obviously, children don't necessarily pay a lot of attention sometimes. Boys consider it a badge of honor sometimes to do things that are gross and disgusting. So when you're dealing with boys, especially, they're running around barefoot in these showers and everything else. And I've never been. If there's a shower and there's another male, I don't think I'm in the right place. Sorry, but at the same time, I understand sports. They have to do these things. Be very careful. Make sure that they have their own towels and washcloths. I'll never forget, I was probably about 10 years old. I can't believe I'm telling this story. I was about 10 years old, and my mother's like, and I'm like, what's the problem? My mom's like, you know what? And she sent me to the shower, and she showed me how to bathe properly. Mom, thank you, but that was rough. That was really weird. But at the same time, I never didn't bathe properly. I mean, I'm talking, I got the hand towel, I can do it on my back, I can do everything, wash, rinse, do everything properly, make sure to do the ears, behind the ears after you shampoo. And that stuff is important. Hygiene's important. And most people are having trouble even telling their kids about Jesus or, the Easter Bunny or Santa Claus and confusing which one's which and which one's real or not, much less telling their kids, hey, Billy, let's learn how to wash. But it's important. Hygiene's important. If you touch things, which I do. I'm not paranoid. If I'm walking up the stairs, I'm 48 years old. I might need to hold on to the handrail. I've learned what it's like not to sometimes. Sometimes you slip and fall. If you're in Iquitos, if you're out there, half the Amazon, it's solid mud out on the banks.
Oh, wow.
So you're going to slip and fall if you're not holding on to something or someone. So we've learned to hold on to things. Well, the things you hold on to, obviously you're holding on to things. Don't touch your face. Don't touch your neck. Treat your hands like you've been handling raw meat every time that you're exposed or touch things outside. When you're going in and out of doors, don't take your hand and push the part of the door where the metal has eroded because so many people have touched it. Walk over to the door, kick it with your foot, hit it with your elbow, hold it up high. Those are the types of little things that can keep people from spreading infection or getting a deadly virus, and it's just common sense isn't common anymore, is it?
No, I don't. I think it's
use
a little bit
uncommon
gone
sense.
there.
Yeah, use uncommon sense and just be careful when if your hands, now don't be to the point where you're going to live in a bubble or you're going to be paranoid about everything you touch. If you're like that, you can't live. But once you start touching the things, remember, you've been handling raw meat. You pretend you have bacteria on your hands. Don't pick your nose. Don't wipe your face. Be careful.
Or your eyes. That's one thing I've done. You end up with pink eye.
Exactly. You end up with pink eye or worse.
Yeah.
Today, all you need to do to have eye disease is to use aftermarket eye drops.
Yeah,
it's
true.
So be careful. And once again, be careful with your eyes.
Well, so with that, someone had asked a question. Let me see if I can find it. One of our family members has pneumonia. Should they wear protective clothing and gloves when they're around them? Since we were speaking about
you say that, and I'm picturing someone literally in a full body hazmat suit.
Yeah, right.
Saying "I love you, honey," and they're wearing, they got a shield. You can't hear, but it's use once again, use uncommon sense. If it's bacterial pneumonia, if they're fresh in it, if you're not a healthcare worker, if you're someone who is never exposed to anything, be careful. Today we had someone come in St. John's, and they were wearing a mask. Now, I know what some people think, and I know what other people think, and it's, people get really judgy about mask or non-mask, or they did about a few years ago especially. Now, a lot of times when people see someone with a mask, they think, oh, they're just a paranoid, person who's overly reacting to whatever. If you're sick and you have to go out in public, that's something that they're doing for you.
Right.
Now, whether or not it's highly effective, or whether or not they're making themselves potentially sicker the longer they wear the mask is beside the point. The point is that those people are trying to protect you from what they have, and that's admirable. You shouldn't judge them for that. And so when we have people who are sick, just once again, based on your immunity. Now me, I'm up in people's stuff. I want to catch everything that I can if it's new or whatever, because I want to make sure that our stuff works. That's sadistically almost strange, but at the same time, she knows it.
True.
Every form of Delta, I'm like, we had a lupus patient right when COVID started. And I'm like, breathe on me. And I was like, she's like, please. And sure enough, there I got COVID. But we also learned that our stuff worked through that. But it's just important for people to use good, basic, uncommon sense and make sure that you're using the amount of protection, or you're just avoiding them. I mean, you don't have to necessarily be around these people.
Yeah.
If you are having to be around them, then it might be an okay idea to be careful. Once again, wearing a mask long term has been proven to not really work. Most of the masks that people use don't work.
No.
Now, if you want to use an N95 and look like some sort of creature off of a horror movie, then yeah, those will work. And
Or
that's-
Chewbacca or Darth Vader, maybe? No.
yeah, Darth Vader. There
That
we
might
go.
work.
Darth Vader. Yeah, Chewbacca would be different. But anyway, yeah, it's so it's you don't want to get sick, but at the same time you need to people need to understand that oxygen is important, and that bacteria, especially if it's a used mask over and over again.
Oh,
well,
please don't.
Please don't do that. And then don't throw it in the parking lot at the grocery store when you're through with it.
That's true. That is very true on that one. Well, earlier when we were talking about malaria, someone had said they were a missionary that works outside of the USA, have always heard that malaria is the greatest mosquito carrier of this disease that we can get. What would you suggest we could do to avoid getting this disease? And I know especially, even in America now, it seems like, I know they've released certain mosquitoes and stuff, but in
Right.
certain areas here, it actually could be an issue. And I know I get torn up by mosquitoes in summer, so what's some options on that?
Well, there are several things that people can do, and number one is to use, I mean, if you're going to be exposed, if you're going to go overseas and get exposed to, Lord knows what, like we do, then it's not a bad idea to be on an antiparasitic and maybe an antiviral. And so by doing that, you can use things as prevention. Even quinine, which was, hydroxychloroquine, all these different things were controversial therapies that were used during COVID. But what was interesting is that every single antiparasitic was somewhat effective against COVID-19. It was an antiparasitic, it would work to some degree, including ivermectin. Ivermectin is literally a dirt probiotic they discovered in Japan, and it's an antiparasitic. That's why it's it's a wormer for dogs and for horses. And so that's one of the reasons it worked, because it was an antiparasitic. There's a time and place for antiparasitics. I mean, you can literally just go to the sushi place too many times, especially the buffets. Come on, really? Sushi at a buffet? Anyway, so people are going to these buffets and they're getting parasites. They don't even understand it. And once again, you go to the medical doctor and talk about parasites. They're like, well, okay, whatever. And they don't really believe in it yet. Of course, you go to South America and they literally will just reach under the counter and say, here's your antiparasitic medication, get better, because they understand the significance of it. But before you go, whether it be quinine, learn and research where you're going. For example, we learned after the fact that the Napo River was full of malaria. That literally north of Iquitos was full of malaria, but not in our village. In our village, that's saying that, but true. It's are no cases of malaria from Tamshiaku down.
Oh wow.
To where the Amazon begins. However, obviously, if you're in lowlands and you're spending enough time there, you could end up with it, especially if you're not from there and you're not accustomed to it. But now dengue and other things are a problem there. So learn your area, learn the history, and stay out of wetlands if you can. Obviously in the Amazon that's impossible, but if you are going to be there, then preventatives, whether it be artemisinin or your quinine or whatever it might be, learn what it is and do it.
Even P77.
Well, see, the P77 is excellent with Artemisia. Too bad we weren't taking it prior to going I'll tell you what, 105.1 degree temperature. She's sitting there. They'd offered us the land to purchase Mama Adela, and so she's laying in bed with a 105.1 degree temperature. I've emptied the freezer on her. She's got peas on her and everything else, and yet she's sitting there with her phone booking tickets on Spirit Airlines.
Oh,
I'm
my
like,
goodness.
Yeah, I'm like, you're a glutton for punishment, woman. That's her, but it was worth it.
It was definitely worth it.
Absolutely.
Oh, well, let's jump down. Let's see. I'm having a gallbladder problem. What suggestions do you have for treating this problem?
Well, and we're not against medicine, and we're not against, half of my friends are medical doctors, even though, they don't admit it publicly, that they're my friend, I'm sorry. Not that they're a medical doctor, they'd be pretty poor. But, when you're dealing with, well, go ahead, talk about it.
The gallbladder?
Yeah, talk about some gallbladder
Well,
stuff.
basically, we've got a really neat cleanse for if you're having gallbladder issues.
It's not our supplements.
It doesn't come from us, really. It's more like the
Olive oil?
Olive oil, lemon juice, apple juice, and the salts, the
Epsom salts.
Epsom salts. And it's a mix, it's a combination, and you have to, do it for several days. And we can let you know, if you're having those issues.
And mainly
how
that's
to do
for
it.
gallstones. And a lot of people are shocked when they hear that you can actually naturally get rid of gallstones. Now you have to be careful. This is the reason, once again, that's why I'm on a tirade in the rabbit trail that made me forget what I was talking about, and that's why I threw it to her. When people are having gallbladder issues, you need to know why. I mean, if you're just a beer drinker who's had a little bit too much red meat for the week, then you probably just have a little bit of gallbladder inflammation, or what they call like fatty liver or fatty gallbladder, and you need something to reduce the inflammation. Simple turmeric is a great example of that. My brother knows about turmeric and how well it can help a gallbladder, especially when you're wanting to go watch the Alabama-Auburn game about 10 years ago, and you're suffering with pain. Literally, he ate a handful, like 12 capsules of some turmeric or curcumin. And we were able to watch that whole game, and he didn't have any more pain after that. We have had so many people save their gallbladders through the simple little concoction that once again, we just tell people for free, and it's a combination of olive oil and lemon juice and Epsom salts. But you really need to, people don't want to blindly just do it. Don't pretend you have gallstones if you don't. Determine what's wrong with your gallbladder. Don't let them take it unless it's an emergency. It's a quick 18 grand they can make just by taking out your gallbladder and say, you don't really need your gallbladder, really? Where's bile produced?
Yes.
So not having your gallbladder will give you permanent digestive issues to a degree, but at the same time, some people have to have it removed via emergency. We're not talking about that. We're talking about people who are dealing with gallstones, having pain. Your gallbladder is located over here on the right side of your rib cage at the curve of your rib. If you can press it and you're having problems and having pain, then that's an issue that you need to deal with. A lot of times it is gallstones, and you can do this. You basically drink apple juice for a few days, and then you take and have this little concoction, which is not very tasty. Think about olive oil, lemon juice. Everything that works is basically miserable. I'm sorry. But we try to make it taste better, but you can't make olive oil and lemon juice and Epsom salts taste good. Sorry.
Gotta hold your nose.
Hold your nose and do it. Maybe it's just inflammation of the gallbladder, and the turmeric and curcumin can help out a lot. But go see a specialist. Get the diagnosis. Figure out what's wrong. Don't let them take it unless you have to have it taken out. But then you can use the natural. We love the convergence of natural and modern. I love technology. I mean, we're sitting there in our cabin in the Amazon. I'm like, daggone, where's the signal? And literally no power in the village.
Right.
Yet there's a cell tower in Tom Shiaku that we desperately need because of communication and what we do. So there's a point to technology. There's a point to modern medicine and diagnosis. But far too many people actually trust the media and actually trust Big Pharma. Now, see, I didn't, that's where the evil comes in. That's where the misinformation, the deception comes in. So your doctor's not some, person sitting there wringing out their hands, sitting there thinking, I need to find new and unique ways to rip people off and get their money. Do you really think a doctor needs your money? I mean, most medical doctors, they're smart enough, they could have done anything. And so these medical doctors are just a victim themselves. They're working 70 hours a week. I know Dr. Edmond down the street, a friend of mine, we talked this morning, working together about a patient. I mean, he calls me with his patient in his office, and we talked and discussed, because the patient was talking about natural remedies that he wanted to become more familiar with. And we did. I sent him the articles, I sent him the studies, and I sent him everything via text. And it's just wonderful that there are physicians who care that much, but they have to work really hard to care that much, or really to get the information. And so many of them are just bombarded with big pharma, just brainwashing that they are so limited in what they can even say. I mean, they'll get punished, they'll get reprimanded. We have local doctors who are banned from hospitals because they didn't take a vaccine. So, yeah.
I hate to cut you off, but our time is up for the night.
Already?
So, I know, it goes fast. So everybody out there, please continue to watch Thursday nights, 7 p.m. here, and then send in questions, call with questions. Send them in on Facebook even after the show, and we'll try to get them to answer it, but definitely live. It's even better. We want to thank you for joining us, and thank you both for being here. And definitely come back next time for Truth, Health, and Wellness with Deborah and Matt St. John.